Welcome to today's Health Edge. I'm Dr. Stephen Vold of Vold Vision in Fayetteville, and this morning we're going to talk about ocular allergies. What do ocular allergies look like? Well, there's a number of symptoms that people have. Number one, first and foremost, is itching. So when you have itching eyes, that is very likely due to ocular allergies. These can be environmental allergies, it can be from ocular makeup that people use around their eyes, and sometimes it can even be from medicines that have been used around the eyes. So for instance, if someone's been using antibiotics or glaucoma medicines and your eyes are turning more red, that can be an allergy as well. Other symptoms you're going to see is something we call a contact dermatitis, which is redness and scaling of the skin around the eyes. We can also see, obviously, redness. And one of the things that we notice on an examination is something we call papillae, or little red dots all over the eye. The other thing we'll often see is tearing. What can we do to prevent these things? Obviously, we want to avoid the allergen first. And so as the molds and the ragweeds and all these things come out this time of year, if we can avoid those things, then that would be number one. I can tell you sometimes we can't do that. In makeup, however, in different medicines, we can obviously avoid those things, especially when we have known allergens. Other things that we can do are ocular testing for allergies. And there can be skin tests that are done, and then we can do other things that will help us determine whether you are allergic to medicines, even by examining your eyes. Other things that we do is treat symptomatically. So artificial tears, cool compresses can work really well in helping with mild allergies. With more moderate allergies, we'll use antihistamine type things and something called a mast cell stabilizer, which will make it so these cells don't produce these toxins that will cause the redness. And then lastly, we use something called steroids or non-steroidal anti-inflammatory medicines that can do that. And we can do that in a drop. And then the other thing we can do, there are systemic medicines, whether they're oral steroids or oral antihistamines, that can also help with allergies. I'm Dr. Stephen Vold for today's Health Edge. Have a wonderful day.